Hi, Kevin Seidenstricker with American Media, an affiliate of Mansion Entertainment Group. Today's Wellness Wednesday topic is an eye-opener. Did you know that orthodontic treatment can help you get better sleep? Here today to talk with us and explain the effects of poor oral hygiene and other factors, and how that can affect your sleep wellness, is Dr. Sayfo with Uncommon Orthodontics. Welcome, Doc.
Good morning.
Good morning. Thanks for being here, and thanks for being able to explain to us the connection between oral hygiene, orthodontics in particular, and sleep apnea.
Let me just start by explaining sleep apnea is the somehow a repetitive episodes of waking up during the night because of obstruction of your airway. So we will start by talking about the obstruction of airway, and I want to focus about the effect of that on the kids first, because it has a major effect first on the kids' wellness, behavior. Because if you don't get enough sleep at night, you will wake up hyperactive. Most kids are diagnosed by ADHD just because they are hyperactive or lack of their attention, but they actually didn't get enough sleep. Now, sleep apnea is counted as mild, moderate, or severe based on how many times you wake up per hour. And you'll be surprised that some people with severe sleep apnea, they wake up more than 30 times an hour. So imagine I wake you up every 2 minutes. You will never get good sleep. You will be tired in the morning. And then, of course, you will not be having a good life. Now, in orthodontics, we start by diagnosing that. And to be honest, we are not specialized in sleep study or sleep medicine, but we can sometimes, because we see the patients in a very, very early age, we can diagnose that this patient does not breathe properly, or they have some significant signs or symptoms that's related to sleep apnea or any kind of obstructive airway.
And Doc, what are some of those prevalent systems that you might see from your chair?
Yes. So mainly we see that the patient that does not sleep properly or breathe properly during sleep, or do not breathe through their nose, if that patient is a completely mouth breather, we will see that their maxillary, which is the upper jaw, is not well developed. It's narrower, it's smaller. That affects their look, that affects the major benefit of breathing from the nose, which is humidifying and warming the air, and at the same time, because the air goes in and creates pressure in your sinus, help the growth of the middle of your face.
Okay.
So it will affect literally the growth of the middle of your face, and at the same time, your airflow from your nose and the growth in general.
So if you are one of those mouth breathers, as you describe, how can that worsen a person's oral health, especially a child's?
So when you are a mouth breather, imagine you are breathing from your mouth when you are sleeping or all the time. First, your mouth will be open more than you should be. And that air will dry your teeth, dry your gum, make your make your saliva a little bit more sticky, and then you're brushing harder. You will have a worse mouth odor, and at the same time, oral hygiene will be lower because the flow of your saliva, instead of being really fluid and cleaning your teeth, is going to be more sticky. And people don't know, when you breathe from your mouth very repeatedly during the night or during the day, you are more prone for your tonsils being enlarged.
Okay.
Because they are irritated by that air.
I have experience with family members, older family members, who have suffered from sleep apnea. I know we want to focus on the children, but in my experience with older adults, they're often prescribed a CPAP machine.
Yes.
How does that help?
So the CPAP is actually a pressured air. So it takes away the fact that you cannot, by yourself, when you're sleeping, take that air through your airway. So the CPAP is a mask that's fit on your face, and it pushes oxygen and air through your airway. Now, it's good because you sleep well, but imagine you are addicted to that machine. Wherever you go, I mean, I tell all my teenagers, it's not really a good first date impression. And at the same time, some studies, I'm not sure about the how accurate or not, they found that some machines are building some form of a mold because it's literally humid air that goes in and out all the time. They're finding some kits to clean it, but it's really not reliable. So I think the medical intervention to fix the problem is the way to go.
Is there a medical intervention for some type of surgery? I think I saw in your notes, which I didn't have a chance to research properly, something like an orthodontic
Yes.
surgery?
If you are a younger patient that we can diagnose this kind of issue, we can work on expanding your upper arch or even work on your growth, kind of like a growth modification to move your upper arch forward and that somehow widen and help you breathe better. If you need any kind of surgeries for your tonsils, adenoids, something that you can work with your pediatric surgeon or ENT, that's another way. Now, with adults, when you have that narrow arch or collapsed airway, if your sleep study indicates that this is the way to go by moving your upper jaw forward and widen this area, then yes, we can do an orthodontic surgery that creates a wider airway, and then I cannot emphasize how many times I heard from people who did the surgery after, of course, diagnosed by a sleep doctor, that after the surgery, they tell me, this is the first time in my life I had a fresh air, or like I felt the breath of fresh air.
That's amazing. So you as an orthodontist can then collaborate or work with other medical professionals, surgeons and such, to give a comprehensive treatment to sleep apnea and oral health.
Yes, if of course it's diagnosed that this is the problem. Mm-hmm. Now, I do not diagnose any kind of sleep issues, sleep apnea, or any airway obstructions. I sometimes can screen and see that there's a problem, and then I refer the patient to the proper channel through ENT or a sleep doctor. And then if they instruct us like, yes, the problem is the upper arch. The problem is that the palate or the maxilla is narrow, which is at the same time the nasal floor. Mm-hmm. The top of your mouth is the same size of your the floor of your nose. Oh. So if you expand that, you automatically expand your nose. If we are instructed that this is the problem and we need you to fix it, then yes, we can address that.
Doc, I love having you on this show because I learn so much every time we're sitting here talking across the desk from each other. One question I have is, what kind of causal factor is sleep apnea to other risk factors in adults and children?
Yes. Having any kind of airway issues, sleep apnea or lack of oxygen, lack of sleep, complicates a lot of medical management, because now you are not sleeping well, all your systems are not resting. It found that the management of high blood pressure or cardiac issues, even diabetes, or weight management is affected by sleep apnea. So sometimes we tell people like, hey, patients with higher weight are a risk factor for sleep apnea, but at the same time, if you have sleep apnea, it's very, very hard to control your weight.
Sure.
So it's kind of like both ways.
Mm-hmm. Kind of a cycle,
yes,
if you will.
Absolutely.
Right.
Absolutely.
Well, I'm also curious then, in addition to treatments like wearing a CPAP or some other like a reconstructive surgery in the mouth, in the sinus area, is there any type of a lifestyle change that I might affect myself that could help my sleep apnea?
Yes, we found that patients with higher weight, more of kind of like alcohol or any kind of drugs, especially late at night, is kind of a factor that worsen your breathing and kind of like a risk factor for sleep apnea. So changing your lifestyle by losing weight, being a little bit more athletic, or working out, not consuming a lot of alcohol, or at least not before bedtime, helps a lot.
With this type of management, these different treatments that we've discussed, they sound maybe a little complicated, a little risky. In the end, is it worth it?
Yes, absolutely. Absolutely. You are changing your life.
Yeah.
You know, you are literally changing your life. Now, a patient that lived all their life with sleep apnea might not know what is the proper sleeping is or proper breathing is. They know that there's a problem, but they never experience it.
Okay.
So they literally don't know what's at the end of this bridge. But no one ever addressed this problem and came back and said like it was not worth it. It's life-changing experience and life-changing approach that literally you're going to find yourself in a way better situation. And honestly, I tell all my parents that they have kids that were diagnosed with ADHD, go check if they are sleeping well. Go check if they are breathing well. Because if you don't get enough sleep, you will really be hyperactive, lack of attention, all these kind of signs that we sometimes rush to give that kid ADHD medication, that I think sometimes it's not the proper diagnosis if we don't look at the airway.
And Doc, I know we were wanting to focus mostly on children this morning, but I'm thinking in the terms of adults and benefits that they might realize. One we didn't mention was it could save a marriage, couldn't it?
Oh, absolutely, absolutely. You know, it's funny. I just still remember that my mom and dad, each one of them used to like accuse the other one that he or she is snoring and wakes her up or wake him up during the night. But they're both like, you know, both trains like sleeping and living next to each other. And I wish that I knew this earlier, that I could really approach them with this suggestion. But absolutely, it can save a marriage. Yes.
Dr. Sayfo, thanks for being with us today. Like I said, we always learn so much by having you on the show. Thanks for being here.
Thank you. I appreciate it. Thank you.
Dr. Sayfo with Uncommon Orthodontics. And where can we find you, Doc?
Yes, sir. We Uncommon Orthodontics is located in 2330 South Range Line in Joplin. You can find us on uncommonortho.com or on our social media on Facebook and Instagram.
Okay. Thanks again, Doc, for being with us. I'm Kevin Seidenstricker with American Media, an affiliate of Mansion Entertainment Group. Thanks for watching.